Cooper, your host on Change Your Voice, Change Your Life. My host is John Curtis, Dr. John Curtis, and the title of the program
is Strangled Voices. Who's afraid of cures?
Who is afraid of cures? Cures of what? Strangled voices?
Very serious problem. Yes, it's been going back since 1871, first described by Traub. It's called the strangled voice. I mean, it's a condition that's regarded today as hopeless. And I find that very interesting, because who in the medical profession decided that the strangled voice was hopeless?
The medical profession decided because they have no cures.
But
you pointed it out.
Who decided they have no cures?
They decide. The medical community writes in its medical journals, at its conferences. It guarantees that there are no cures of spasmodic dystonia.
What happens when a patient comes in and you tell them that there are cures? Well, who are they supposed to believe?
The medical community.
They're not supposed to believe you?
No.
Then why are you telling falsehoods then that there are cures?
Well,
if the medical profession says there are no cures.
The question is, who's telling the falsehood?
Okay. Well, why don't you explain that?
Well, the medical profession is humanitarian. They're well-intentioned and they're very compassionate. They're trained to put things into the vocal cords, to give you a shot of some kind, or to excise, take tissue out of the vocal cords, growths, nodes, polyps, contact ulcers, premalignancies called papillomatosis, leukoplakia, and keratosis, to help you if you have bowed vocal cords, if you have a unilateral cord paralysis, and so forth. They're trained surgically to do what they're doing. My take on the whole thing is that you can do it by direct voice rehabilitation. It's all natural, and it's very simple. It's so simple, it's mind-boggling, and I report cures of all these conditions that I mentioned. Papillomatosis, which is a premalignancy, I published in peer review. I did a dissertation on it while at UCLA, got my PhD there. And I wrote a textbook called Modern Techniques of Voice Rehabilitation. It's in the library, so you can get it, no charge. And I wrote books called Stop Committing Voice Suicide, Winning with Your Voice, and a bestseller which is in the going into 19th printing called Change Your Voice, Change Your Life. These books are in the library, which indicates that what the medical people do for our voices, our bad, raspy, and strangled voices, the growths on the vocal folds, needn't be done. That it's a medical treatment, but there is another treatment called non-invasive treatment, and what I do is called direct voice rehab. It's not invasive, it's non-medical, and it reports cures of all of these conditions I've spoken about, including the strangled voice.
Well, you still didn't answer my question. I want further clarification on this, and forgive me for putting my journalist hat on right now. I am a syndicated columnist, and what I want you to explain to me is you have done some research as to who decided that the strangled voice or spasmodic dysphonia is not curable.
The medical community. They've never had a cure.
Who in the medical community? Was that Arnie Aronson? Was it Christy Ludlow?
All of them.
Was it, who decided? Because every time you've asked these people who decided that this condition was incurable, they all tell you that they don't know. We weren't on the committee. Why can't they answer the simple question? If it's not curable,
it's called herd-like. Do you know what a herd is?
It is herd-like.
Yes, herd. Do you define the word herd?
Well, that sounds similar to GERD.
Yes, well, now...
But there's a GERD herd out here now.
Now the medical community is saying that strangled voices are caused by GERD, gastroesophageal reflux. They've made it a disease. There are some people who have a problem, and it may be a disease, but the mass of people with GERD, gastroesophageal reflux, are not in the category of it being a disease that I know of. In fact, what they've done, this study of making acid reflux associated with bad and raspy voice and strangled voice as the cause, is a study done by Merck in 1992 with about 350 people, and I have seen endless patients, countless patients in my 45 years being in the field as a voice clinician and a doctor of voice, getting my degree at UCLA in 1964, and serving on the staff and faculty for about 8 years and running the voice and speech clinic, is that these factors such as acid reflux are a fad as to causing bad and raspy voices, and especially strangled voices. There has been sinusitis, allergy, postnasal drip cited. I talk about that. They're not relevant to the basic cause of voice problems.
Okay. We're still not getting to the question about who opposes cures, who's afraid of cures. Where's the panic? Why wouldn't they celebrate a cure? You've had a cure for over 35 years in the work that you've done.
Ongoing cures. 15 cures alone of diagnosed SD, spasmodic dysphonia, by the staff and faculty of the Head and Neck Division.
Non-invasive treatment. I mean, no implants, no drugs, no surgery. Simply something, people follow some instructions that you give them. You put them through some exercises, and their voices improve. Why is it
and cured
and cures? Why is it that word cure is actually something that is not part of the medical vocabulary when it comes to treating voices, especially spasmodic dysphonia?
Because it brings the whole medical edifice down. The whole edifice falls to pieces. The medical community, especially the ear, nose, and throat field, is trained to do surgery or to inject substances such as Botox now. They're trying to do implants into the vocal cords, putting cadaver skin into the vocal cords, or collagen. They've tried paraffin in 1913.
Teflon?
Pruning. They've tried Teflon, they've tried silicone, they've tried, you name it, they've tried it.
And they're trying to...
It's an iffy situation.
They're trying to fill in a gap, right, with respect to the position of the vocal cords.
Or unilateral cord paralysis.
So if they can fill that gap and they think they can get more vibrational effect from the muscle.
They're looking to structural efficiency, but they're not understanding it's the misuse of the voice that's creating the structural deficiency.
But would you agree with the fact that if you close the gap in the vocal cord, that you're not necessarily improving the function of the muscle?
That is correct.
Would you agree with that?
Oh, absolutely. That's where they're making the mistake.
Well,
that's why the substances they inject into the vocal cords, whether it's paraffin, silicone, collagen,
do you agree with Robert?
Is not working.
Do you agree with the former editor of the journal Voice, Robert Sadeloff, based out of Philadelphia, that he can perform a voice lift, like a facelift for somebody? He can actually rejuvenate a human voice by injecting the vocal folds with collagen. Do you agree with that position?
No, not at all.
But I mean, collagen is being used for facial
putting into the vocal cords that are 3/5 of an inch long in a woman and 4/5 of an inch long in a man destabilizes the vocal cord. If you have a substance put into your upper lip to your bottom lip, and the vocal cords are like the orbicularis oris, these are the lips. If you have a substance put in, do you think you're going to be able to talk? You get a substance when you have your teeth worked on. Do you think it helps you to talk? It's slurring. It destabilizes the vocal cords from what I've seen. Maybe I'm seeing only the destabilized vocal cords and the failures of implants into the vocal cords. Those are called implants. And the biggest implant today into the vocal cords.
Is that Botox?
It's Botox. And it's the world's deadliest poison. It's called Bo for botulism, and tox for toxin. And they make it a sweet, cuddly sound so that when you're told you should have Botox, you think, oh, but they're not telling you the outcomes of
I read an ad recently.
Implants.
Look, what you're saying here is, I have to tell you folks, Dr. Cooper is giving definitely his point of view on this, but I read a full-page ad in the New York Times, and that ad was very convincing because it said that Botox is a natural purified protein and that it has no adverse side effects. Now, are you saying that the drug maker Allergan would ever report false information in a full-page ad in the New York Times?
Dr. Curtis.
I don't think so.
Dr. Curtis.
This is a responsible, publicly traded company.
Dr. Curtis, I respect you, but I am listening to baloney. You're cutting it thicker than it's possible. The masses are not told what.
What'd you say about the masses? You said it's something that rhymes with the masses.
The masses, by witty people, are saying the masses are asses. It's not that they're asses; that they're simply.
You mean they're dum-dums? I mean,
no,
you
they're
think
not dum-dums.
The wool's been pulled over their eyes.
No, they can't believe that the medical community would not be giving them the truth. The rest of the society, we know the stockbrokers are not going to give us the facts for the most part. I don't believe anything I hear from stockbrokers, and less than...
You've learned something then.
Yeah, well, the rest of the society has too. But we are put upon, and most of what we know is not so. I wrote that, and I do cartooning, so you can accept it as such to that extent. The people who are such as yourself saying it's a purified what kind of purified what?
I'm just reporting what
wait a minute,
Allergan said.
I want you to tell
they
me
said it
purified
was a
what?
natural purified protein.
Yes. Well, the outcome, you see, from clinical experience, I happen to be on the front line, or what they call the trenches. I'm in the trenches. I see what happens with the Botox.
You know, of course, that the AIDS virus is a natural protein also.
Mm-hmm.
The AIDS virus is a natural protein.
Mm-hmm.
Does that help you at all? I mean, when Allergan is saying that theirs is a harmless, innocuous, almost like a health food.
I don't find it harmless and innocuous, as they say. They're entitled to their position. They have good PR. They dominate and control the field, and I wish them well. It's just that I have a different position, different finding. Clinically, my experience is that Botox destabilizes the vocal cords. It paralyzes the vocal cords. The people who do the Botox tell the patients it's 99% effective. They don't tell them effective for what. It paralyzes the vocal cords. It's one of the greatest roller coaster rides you can imagine.
They also
the voice
say they
goes
have
out,
scientific
comes
precision.
in, goes out, goes in, and they give you 4 to 10 Botox shots or more each and every year for your life at perhaps $1,000, $2,000, $3,000 a Botox shot. So they may be unhappy with me because I say publicly and in print that it's a full employment act for the ear, nose, and throat doctors and a lifetime annuity. Now, who could ask for more? They're entitled. They've worked through. They've suffered getting their MD license. I suffered getting my PhD
Look,
license.
Am I incorrect in inferring that you're a bit critical of the medical profession and the pharmaceutical company who makes Botox?
I believe you can use the word a bit critical. I may be overly critical, but I don't find that their stats, what they say.
Look, I saw a video.
Outcome,
I saw a video.
99%.
I want to tell you about
this.
this.
The physicians doing the Botox tell the patients it's 99% effective.
Yeah, that's right.
Does that mean the patients say over and over in email and calling me and writing me and telling me it didn't help me and so forth? Where are these people coming from? They're coming from all over the world. They send us emails and saying they tried it and they're not doing it anymore. They don't want it. Once you get a Botox shot into the vocal cords, it doesn't calm the vocal cords. It doesn't relax the vocal cords. It paralyzes.
Do you know who Michael
cords.
Rolnick is?
Yeah, he's a narrator on the NSDA.
I was watching an NSDA, National Spasmodic Dysphonia.
The NSDA?
National Spasmodic Dysphonia Association. This is a national nonprofit organization disseminating the state-of-the-art information
Where
about
they get
Botox.
their money from?
Look,
where they get their money from?
I asked McAllister that question.
No, wait a minute.
She never got back to me about that.
No, forget about that. Where do they
get the money? They get the money from Allergan,
the maker of Botox.
It's on their website.
On the Allergan website, it says right on the NSDA, National Spasmodic Dysphonic Association. They're entitled to have a front 501c, a nonprofit representing Allergan. I think the world of this organization.
But this fellow by the name of Chip Hanover, who's featured on the video, is a race car driver apparently. NASCAR driver, real macho sort of guy, and this and Michael Rolnick, PhD, did I guess he did a video stroboscopy, a phonatory workup on Hanover.
I don't know. He never said that.
Well, he claimed, and I'm talking about Rolnick, that the physicians who perform these Botox injections on patients with SD, they precisely know the location of where to inject, and B, they know exactly the right dosage, precise scientific dosage.
And you don't believe that?
No, I don't know. I'm asking you. You're the one who's had the experience with the patients. Did Tim Kidwell report that he had A, the precise location injected, and B, the precise dosage?
Do you know what hype is and hoopla and PR? Medical people and the Allergan people, the makers of Botox, are entitled to their view, which they present through this 15-minute flick. But reality is something else. I think they do a very good job of telling the public and the media and the patients what they want the public, the media, and the SD patients to believe. It's just not real from my experience, clinically speaking. They don't know the dosage. And if you start asking
Tim was
the ear,
on the
nose,
show.
and throat doctors, Peek Wu is one of the top people. He's experimenting. Botox is an experimental drug. It is not approved by the FDA, the Food Drug Administration. It is never...
well, it's approved for some things. It's not approved for treating spasmodic dysphonia, right?
It's an orphan or off-label drug because they can use it for eye spasms and neck spasms. But something that the makers of Botox don't want to consider or face is that the eye spasms and the neck spasms may be coming from the misuse of the voice, which is creating strangled voice, spasmodic dysphonia. And why are they afraid of cures? Because cures of this condition then say they're doing something to the human body that may not be relevant or applicable or appropriate. And I'm saying, from my experience, my clinical experience, they're on the wrong road in treating this condition. They've never had a single cure with Botox, and they say there are no cures by Botox or by surgery, and I've been reporting ongoing cures for 35 years. So why would they be concerned about cures of the strangled voice? Because it brings down the whole medical edifice and the drug field.
Well, there's a couple interesting tidbits, I think. We had a young man here who was a minister. I think he was a Baptist preacher. Mm-hmm. His name was Tim Kidwell. Mm-hmm. And he said that the experience was not simply a bee sting of having this Botox injection, but rather it was quite an ordeal for him.
He is not alone.
A traumatic event. That. He said, number one, that it was not precisely dosed, that the doctor asked Kidwell, how much do you want me to give you? Which he found to be very odd. It was very upsetting to him. I remember talking to him about this. And number two, that the Botox started leaking down into his esophagus, paralyzing his ability.
That is not isolated.
He developed dysphagia, which meant he was like choking on his own saliva. He couldn't swallow easily. So what I find interesting about the Botox game, if it is a game, as far as the way it's marketed or presented through the NSDA and others, is that it's all based on science. But from what Kidwell described, what goes on the table, when you get into that table and they start putting the needles in your throat, what happens to the science?
It's not a bee sting. It's dramatic, and the dosage is not specific. And
but what happens to the science? The science goes out the window.
Who said there is a science? The medical people are saying this is the state of the art and treatment of choice, but Rolnick is representing a point of view. He's entitled to his point of view, but there's another point of view, which is reality, and that's what I'm saying. And saying, with the experience of 35 years in this field, treating SD, and the only doctor in the world reporting cures of it is on my website, and being in the field for 45 years, 8 of those years at UCLA Medical Center, and the staff and faculty and running the voice and speech clinic and breaking open all kinds of voice problems and hopeless voices, that this is a view that is sold to the American public that voice problems, not only spasmodic dysphonia, but bad and raspy voices, and there are a huge number of these cases in this country. They talk like this. Now, the spasmodic dysphonia, the strangled voice, talks like this. I thought maybe. You can see the neck muscles, you can see the eye spasms, and you can hear the voice, and it's terrifying. But the medical community wants to make it a medical problem. From 1871, Traub described it as nervous hoarseness. They never had a single cure treating it psychiatrically. 1960, they came up with a study, Rowe, Brumlick, and Moore, suggesting it might be a neurological problem, not conclusive, and making it from there on in a neurological problem without the foundation of documented evidence that it is. Now, the medical people insist at their medical meetings and their medical journals that spasmodic dysphonia is hopeless, incurable, and they're giving 4 to 10 Botox shots a year, or more each and every year for $1,000, $2,000, or $3,000 perhaps, a shot. Now, this is a full employment act for those who do it.
Well, this is botulinum toxin type A. This is the same drug, by the way, that you see advertised
for a lifetime annuity. Yeah.
This is the same drug that I've seen advertised, Botox parties, in the LA Times and elsewhere, for $150 a shot. So why is it that your profession winds up charging?
What are you saying? It's my profession.
Well, I mean, the voice field.
The medical. What are you saying? The voice field. Okay, my field doesn't do it.
The medical voice field
does it.
They charge up to $3,000 a shot.
Apparently, they feel they warrant
the operating room costs, or what factors
because
into this?
they feel they're more sophisticated than dermatologists doing the Botox for the face.
Well, I understand.
You always put down the people at the highest level, and nose and throat doctors.
Well, you find them to be, very competent, skillful surgeons and humanitarians.
to a person, I would say, humanitarian, well-intentioned, and compassionate. On the wrong road, entirely with spasmodic dysphonia.
All right, they're barking up the wrong tree. They're not really changing voices. But then again...
They're changing voices because when you get a Botox shot, you get a roller coaster ride. You've never seen this roller coaster ride. You ought to try it once.
You get a Botox voice.
You get a Botox voice.
Now, a Botox voice isn't a very natural-sounding voice, is it?
You know, I'm talking like that.
It's a very breathy sound at first, and then it starts strangling again. But there is a window in there.
Yeah.
I understand if no one really knows the exact length of the window.
Iffy.
It could be a minute, it could be 5 minutes, it could be a week, a month,
6 months,
where
3
the
months.
patient gets their voice
But
back.
Gerald Burke at UCLA, a head and neck division chairman, has written in December of 1999 in the National Spasmodic Dysphonic newsletter that there are serious outcomes of it, and you need the shot 4 to 10 times a year, I believe, is what he wrote. So.
So do they ever expect to graduate the medical approach to treating spasmodic dysphonia with Botox? Do they ever expect that at a certain point there will no longer be any further need for Botox because the neurological condition that they're assuming causes the spasms or the spasmodic dysphonia will actually be cured? Yeah,
well, the cure is not a cure. One of the patients at the Mayo Clinic had 40 Botox shots over 8 years. She had no voice at all. I got her voice back. She stayed with me in direct voice rehabilitation, and she was shocked. So was her husband. Another young lady came in. She had 45 Botox shots, 45 over 15 years, and she was hopeless. There was no voice, none. They paralyzed the vocal.
That's 3 shots a year.
Yeah.
What's wrong with that?
Another young man who was on this program, Ron Steger, who works for a national organization. Had 5 Botox shots by his ear, nose, and throat doctor. None took, and he needed his voice. His doctor gave him my name and said, Cooper has cures. He has his voice back. He's been cured. It's interesting to ask the audience and yourself, and the question we pose, why is the medical profession so afraid of cures of spasmodic dysphonia? Because it brings the whole house down on
Do you think it turns
the
paradigm on its head?
They have the wrong role model. They have the wrong paradigm.
So you think it turns the paradigm on its head, basically? It says the paradigm is wrong.
Yes.
And it sort of shakes the foundation, the whole theory that goes behind administering these shots, which has become like a cottage industry, especially for some who are lucky enough to give these injections.
I would go back to school if I had the time.
I guess you could become a nurse.
No, I would want to give the shots. But the other thing is, you said something which is very apropos. It turns the field on its head. That's literally what I'm doing.
That's what I'm talking about.
Yeah.
But maybe that's why they don't like you talking about these things.
Why don't you explain what I'm doing? I'm turning the voice from the lower throat, where all strangled voices are, down here talking like that. And it makes your eyes pop out, gives you eye spasms, it gives you neck spasms, back spasms. The medical profession, my colleagues, I know them very well. UCLA, I knew them, I worked with them, got along famously. I came up with cures later on when I went into private practice, and it's not what the medical community has in mind. I'm turning the voices up to the face, where all good and great voices are in the mask, away from the lower throat by pitching the voice. Pitch. It's a very simple modality. It's so simple, it's mind-boggling.
Most people don't want an elevated pitch. They want the lower pitch. Look,
I bring the pitch down, I bring the pitch up.
Don Corleone, I remember Marlon Brando. He played it in Godfather. You remember Yeah. Well, it was like a spasmodic, dysphonic voice he used.
But that's a bad, raspy voice.
That was
coming from the lower throat.
A voice of credibility, of authority.
No, it's not a credibility.
Then why did Corleone?
We have George W. Bush, he has authority. We have Bill Clinton. The rasp. But that's they felt the women felt compassionate toward Bill Clinton. He had that rasp. He was admired for the rasp. But we misuse our voice culturally so extensively, it's mind-boggling. The medical community is not trained to understand that our failing voices, nodules, polyps, contact ulcers, premalignancies, papillomatosis, leukoplakia, and keratosis, when it's not smoking related, broad vocal cords, and unilateral cord paralysis, not caused by surgery or cut in the recurrent laryngeal nerve, that essentially nearly all voice problems are due to misuse of the speaking voice or the singing voice.
Okay. what you're bringing up is an interesting dichotomy, as it were, which is the medical worldview, medical paradigm. And your paradigm, you're saying that the voices can be retrained. You're saying that people can change the way they speak, and they can get out of this deep throat sort of talking, get to a point where they can actually have clear and powerful voices through a little bit of exercise and training.
I'm not saying that. I'm documenting. I have peer reviewed for what I'm saying. I've gone the whole route. The protocol is to peer review, have your stuff published. I've been published in medical journals, in academic journals. I've been honored by the American Speech and Hearing Association for breaking open all these voice problems we're talking about. It's an interesting field that I'm in, but it's changed in the last 25 years to medicalization.
Like, you say the word, it's interesting. I mean, what I'm hearing you say is it's exasperating, it's frustrating, it's maddening. This is madness. These people are on the wrong road. They are ejecting people, operating on people. Why don't they get with the program and say, look, you can retrain the voice?
They would be out of practice in a sense. They're doing surgery.
No, but this is let's be honest with patients. Let's be upfront. Let's get the real information out there. Let people make a choice.
They are trained to do medical treatments. That's what they do. That's what they're going to do, and that's the way it's going to be. But there was a statement in Voltaire's Candide, and you know who Dr. Pangloss was?
Yeah.
What did Dr. Pangloss said?
I think Dr. Pangloss, he said that this is the best of all possible worlds.
Where was he in front? Of dismembered bodies, heads, and so forth, standing in front. Is this not the best of all possible worlds?
Well, you're not saying that the medical profession is murdering people.
No, but he's saying this is the best of all possible worlds. So if there are these problems with the medicalization, that's the way life is, and that's where we're at. Dr. Curtis, we've run out of time. Thank you very much. What's the title of the program? Who's afraid
of strangled voices or something? Cures.
Okay.
That's it.
Thank you very much. Bye-bye.
Look, you think it's an economic issue, but maybe they're just embarrassed. Maybe it's just turning the profession on its head. Think about what I'm saying. You're putting the voice up in the mask, which is turning the voice on its head. They're saying that, look, this is a neurological problem. They have evidence. They have scientific proof for this back in 1960. And you're saying that 10 subjects wasn't enough.
They can't find it. They've never been able to document the fact it's a basal ganglia problem.
I asked
a brain problem.
Look, Donald McNeil. I asked Donald McNeil Jr. at the New York Times, what was the source of this information that Botox is giving patients strangled voices? He couldn't come up with anything. So where did he?